Blood has a smell that hospitals never fully bury. It lives under the bleach and the antiseptic foam and the cheap lavender spray that someone in hospital administration decided made the dying feel more comfortable. It seeps through every layer of institutional pretense and announces itself 2 minutes before the monitors catch up and 4 minutes before anyone else in the room understands what is happening. Marcus Webb had worked in the emergency department at Mercy Regional Medical Center for 3 years, and in that time he had learned to identify the smell the way some people identify weather. It arrived before the symptoms. It told you the truth before anyone was ready to hear it. Nobody asked Marcus Webb what he smelled. He was standing in the supply corridor on sublevel 1 at 10 past noon on a Thursday in October, counting boxes of sterile gauze with a handheld scanner that chirped every time he pressed the button. The fluorescent tube above him buzzed at a frequency that belonged behind the eyes rather than in the ears, a low, abrasive hum that burrowed into the back teeth if you let it, and Marcus had learned not to let it. He had learned to let most things go, deliberately, quietly, with the particular patience of a man who had made a decision to disappear and had gotten very skilled at it. The elevator at the end of the corridor opened. Dr. Ryan Caldwell came out already talking. Webb, not a greeting. A notification, delivered at a 3/4 angle, the way Caldwell delivered most things to most nurses, facing slightly away, as if full eye contact was a resource he rationed. IV card in Bay 4. Restock it before 2. Ortho is coming down for a consult, and I am not having them see a shortage board. I'm in the middle of the quarterly count, Marcus said. Supply director needs the numbers by end of shift. Caldwell looked up from his phone for exactly 1 second. The supply director works for this hospital, Bay 4. He walked back to the elevator. The doors closed. Marcus looked at the scanner in his hand. He set it on the shelf. He went to restock Bay 4. This was the mathematics of being Marcus Webb at Mercy Regional. He was 34 years old, he had a nursing degree, and 4 years of postgraduate trauma experience that no one had asked about in detail, partly because the detail was classified at a level that required a security clearance to read, and partly because nobody had thought to ask. He had 3 commendations, a Joint Service Achievement Medal, and a scar along the left side of his neck from shrapnel in a country that did not appear in his civilian employment file. He moved through the ER with a deliberate, measured economy that the staff read as slowness and Caldwell had once characterized in a performance review as lacking urgency. He was also the only black male nurse on the shift, which at Mercy Regional meant he was the person Caldwell sent to restock shelves, and the person charge nurse Sandra Pryor assigned to the discharge pile, and the person the residents called the quiet one in the break room, as if quietness were a kind of vacancy rather than a kind of discipline. He had been disciplined for a long time. You got that way after the thing in the valley in Kandahar, after the mission that was supposed to be a 2-hour vehicle extraction and became something else entirely in the space of 40 seconds. After the part Marcus did not talk about and would not talk about, the part that ended with him on a medical transport to Landstuhl and 6 names in his head and only one of them his own. You got quiet after that. You got careful. You put yourself in a building full of sick people and you kept your head down and you fixed what you could fix and you did not reach for the things you couldn't. Invisible. That was the word. That was the plan. He was restocking the 3rd shelf in Bay 4 when he noticed the boy in Bay 7. 8 years old, maybe 9. Brought in by an aunt who was sitting in the plastic chair wringing a paper cup into a spiral. The resident assigned to the bay, a 2nd year named Foot, had her back to the patient and was typing intake notes with the careful, deliberate speed of someone learning the keyboard. The boy was lying still on the gurney. His eyes were open. He was looking at the ceiling. Marcus set down the IV bags. He walked into Bay 7 without announcing himself. He moved to the side of the gurney. He pressed 2 fingers below the boy's left wrist and found the radial pulse. Fast and thin, the way a wire gets when it's overloaded. He looked at the fingernail beds. White. He looked at the boy's abdomen. The muscles there were doing something quiet and telling. "Hey," Marcus said softly, "does anything hurt besides your arm?" The boy turned his head slowly. "My stomach hurts." Marcus straightened. He looked at Foot. "He needs a fast exam. This is a splenic injury, not an arm injury." Foot turned from her screen with the expression of a resident whose intake has been interrupted by a nurse. "I'm in the middle of documentation. He fell from a bicycle. The arm is the distraction. His pressure is low, and he's guarding his abdomen. I'll order imaging when I'm done. He doesn't have time for you to finish." Foot stared at him. She had the face of someone rehearsing the correct way to establish hierarchy. "Thank you, Marcus. I've got it." Marcus looked at the boy for a moment. Then he walked to the nursing station. He pulled the boy's chart. He entered the blood pressure reading himself. He flagged the file for the attending with an alert for abnormal pediatric hemodynamics. He went back to restocking. 22 minutes later, they wheeled the boy to ultrasound. Splenic laceration. He went to surgery at 1:40 and walked out of the hospital 3 days later with a sticker from the pediatric recovery nurse and a bandage around his midsection. Marcus was on overnight when the boy left. Nobody mentioned the blood pressure flag. He had not expected them to. He was at the nursing station at just past 2 in the afternoon, entering discharge notes, when the floor moved. Subtle. The kind of movement that registered in the molars before it reached the ears. Marcus went still with his hands on the keyboard. The fluorescent light above the counter flickered once. He waited. 8 seconds later he heard it. A deep, rhythmic percussion coming through the building's concrete skeleton rather than through the air. Not a sound so much as a pressure. Concussive and syncopated, reaching him through the soles of his shoes before it reached his eardrums. He counted without thinking about counting. 5. His pulse, which had been at 56 beats per minute for the duration of his shift, moved to 60. For Marcus Webb, that was a significant number. The nurses around him were still moving. Someone was laughing at something on their phone near the supply cart. The monitors were cycling through their ordinary patterns. The ambient noise of a mid-afternoon emergency department rolled on without interruption. They hadn't felt it yet. He stood up from his chair. Sandra Pryor appeared at the charge desk from the medication room with her reading glasses pushed to the top of her head and a tablet in her hand. She stopped when she saw Marcus standing. "What is it?" she said. "Clear Bay 1, Marcus said. "And get trauma surgery on the phone." "Marcus?" "Sandra." His voice did not rise. It did not need to. "Please." She looked at him for a second that lasted longer than a second. Then she reached for the phone. The red emergency line at the charge desk rang. She picked it up. She listened. Her face changed in a way Marcus had not seen in 3 years at Mercy Regional. "How many?" she said. And then, quieter, "What do you mean you can't divert them?" The ambulance bay windows shook. Not rattled, shook. A deep physical vibration that sent a tray of instruments sliding off the counter in Bay 2 and made the hanging IV bags sway on their poles. The corridor lights flickered and held and flickered again. Outside the frosted glass of the ambulance bay doors, the sky turned white with rotor wash, the kind of concentrated downwash that had nothing to do with civilian aircraft. "Code yellow," Sandra said into the phone, and then louder, for the floor. "Code yellow. Clear the halls. Trauma incoming. Ambulance bay, now." The ER fractured. Nurses collided in the doorways of the bays. Caldwell came out of the attending office, already issuing instructions, at a pace that had not yet caught up with his comprehension of the situation. An orderly shoved an empty gurney into the wall and left it. Foot appeared from the pediatric section with wide eyes and a folder she was gripping like it had weight. Sandra was on the radio and the phone simultaneously, her voice flat and controlled, both conversations running in parallel channels that did not interfere with each other. The ambulance bay doors blew open. Not slid, blew. The force of 5 Black Hawks hovering above the hospital's west parking structure hit the emergency department like compressed atmosphere, like the instant before a concussive event. All pressure and heat and the thick, unmistakable smell of aviation fuel and hot turbine exhaust, and underneath it all, underneath everything, the dark copper bloom of massive hemorrhage. The double doors swung hard into their stops. A gust of cold October air rolled through the triage area and scattered paperwork from the charge desk and knocked a plastic water pitcher off the edge of Bay 3's counter. The first men through the door were not carrying anything. They moved through the space in a controlled wedge, two peeling left, two peeling right, occupying the room in a way that had nothing performative about it. They wore full-plate carriers over combat shirts, dark with dried sweat. Night vision mounts pushed up on their helmets. Boots caked with the specific red-brown mud of places that were not here. Their eyes did not track the way civilian eyes tracked. They moved through the room in sectors, reading exits, reading heights, cataloging every static and mobile element with the systematic attention of people for whom reading a room was not a metaphor. The civilian staff froze, not because of the weapons, which were slung, not drawn, because of the quality of attention these men carried, because the room had just been divided by people who knew how to divide rooms, and standing inside that division was involuntarily clarifying. The patient came through behind them on a military litter, 4 operators running it at a controlled jog that ate the distance to Bay 1 without wasted motion. The man on the litter had been large before whatever happened to him, which made the ash-pale color of his face more alarming by contrast. His right shoulder was wrapped in a field dressing the size of a dinner plate, soaked entirely through in a color the fluorescent lights rendered almost black. His left hand was taped around an IV line running dry. His breathing was shallow and mechanical, the kind of breathing a body produces when it is no longer negotiating with the situation. Marcus looked at the dressing. He looked at the angle of the man's neck, at the subtle deviation of the trachea, at the paradoxical quality of his chest rise. He looked at the place below the right clavicle, where the field dressing was doing work it was not designed to do indefinitely. He recognized the geometry of what was happening beneath it. He recognized the face. The recognition arrived without drama. A fact, landing. Captain James Holloway, Iceman, 6 feet 3 inches in combat boots. The man with the voice that carried across a firefight without ever rising above a conversational register, who had once held a security perimeter for 41 minutes on a fractured fibula and mentioned it in the debrief as an administrative note. The man who had pulled Marcus out of the wreckage of a destroyed vehicle in Kandahar by the collar of his kit with one hand while returning fire with the other, and who had said, in the flat, precise tone he used for weather reports and grid coordinates and matters of immediate life or death alike, "We are not done, Sergeant," which was not a comfort exactly, but was more useful than a comfort. Marcus had not seen him in 3 years. He was seeing him now, and Holloway was dying. Dr. Caldwell had assembled himself in the corridor with the posture of a man whose professional territory was under invasion. He raised his hand. "Stop. This is a civilian medical facility, and you will not—" The lead operator peeled away from the group, moving toward Bay 1, and stopped in front of Caldwell. He did not touch the doctor. He did not raise his voice. He occupied the same 18 inches of space in a way that clarified, without hostility and without ambiguity, whose those 18 inches were. "Bay 1, the operator said, open or closed. I am the senior attending on this floor, and I am telling you that you absolutely cannot bring armed personnel into a civilian hospital without—" "Bay 1. The operator looked past Caldwell to Sandra at the charge desk. "Open or closed?" "Open," Sandra said. Her voice was flat and functional. "Good." They moved. Marcus watched from the edge of the station. He watched Caldwell follow the group into Bay 1, watched the attending start running through the architecture of authority, ordering lines, calling for imaging, speaking in the high declarative rhythm of a man who needed the room to understand who was in charge. He watched the monitor numbers come up on the station screen as a nurse called them from inside. Systolic 68, heart rate 142, respirations shallow and fast. The lead operator had planted himself against the far wall of the bay. He was not watching the patient. He was scanning faces, moving through the crowd of hospital staff with the methodical attention of a man who had been given a description of something and was looking for it in a room full of things that were not it. Marcus had been invisible for 3 years. He stayed where he was. 62 over palp, the bay nurse called. Caldwell ordered a CT. Marcus moved to the supply rack outside Bay 1. He pulled a sterile field kit. He pulled a vascular clamp set. He pulled a number 11 blade and a number 10. He snapped on nitrile gloves. He did this without rushing and without narrating himself. He walked into Bay 1. "The laceration is subclavian," he said. His voice was at its ordinary register, not loud. "Present the way a load-bearing wall is present. Proximal. The field dressing is tamponating it. When his pressure drops another 8 points, the tamponade releases, and you lose him in under 90 seconds. Caldwell turned from the monitor with the face of a man encountering a category error. Webb, a word placed like a period. Not now. The CT is 6 minutes. He has 4. I have the situation under control. His neck veins are flat. His trachea is deviating left. Marcus moved to the table. Not requesting. Arriving. 2 units of O- wide open. Subclavian approach kit. Number 8 tube on standby for airway, if his sats drop. He looked at the nurse nearest the cart. Can you pull those? The nurse looked at Caldwell. Webb, Caldwell's voice rose by half a register. You are on a float assignment. You do not have surgical privileges. You do not have a medical degree. Step back before I call security. From the wall, the lead operator said, "What is his pressure?" Caldwell turned. "My clinical decisions are not..." "His pressure," the operator said again. Still quiet. The way bedrock is quiet. 58 over 40, called the bay nurse. The operator straightened from the wall. His eyes moved through the room one more time. Not tactical now. Searching. He was looking for something specific. Some face or posture or quality of stillness that matched something he had been told to look for. His eyes found Marcus. He went still. Then, from the doorway, a different voice, rougher, a voice with geography in it. "Marcus." He turned. Master Sergeant Deke Torres was standing at the door of Bay 1 in full kit, his right hand wrapped in a brace that had not been there 3 years ago. His face had added years around the eyes, the kind of years that are not age exactly, but are what age is called when it accrues the hard way. In the field, at altitude, in the particular darkness of operations that do not end cleanly. He was looking at Marcus the way people look at things they had stopped expecting to find. He said, quietly, without ceremony, without theater, Ghost 7. The name moved through the air of Bay 1 like a signal through wire. The operators along the wall shifted in a way that was not movement exactly, but was presence, reasserting itself. The civilian nurses looked at each other. Caldwell's head came up. Nobody in the room who did not know the call sign understood what it was, and nobody in the room who did know it moved for a full beat. "Torres," Marcus said. "Iceman asked for you by name." Torres's voice was steady and fractured at once, the way a support beam sounds when it is holding maximum load. 6 months ago, when he found out you were here, he was going to come himself. A pause. Then Kandahar got complicated again. Marcus looked at Holloway on the table. He looked at the dressing. He looked at the monitor. He looked at his hands. "Move the doctor back," he said. Torres stepped into the bay. He put himself between Caldwell and the table, not aggressively, not quickly, simply with the finality of a door that has decided to be closed, and Caldwell took 2 involuntary steps backward and found the wall and stayed there. The attending's mouth was open. He was performing a calculation. He arrived at no answer that was useful to him. Marcus was already at the table. He had done this in the dirt. He had done this in a burned-out building, in a city that did not appear on any map he was authorized to carry, with a headlamp duct taped to his helmet and a kit bag that had been dropped twice and opened once when it should not have been. He had done this with his hands so cold they should not have been able to find anything, and they had found it anyway, because the body is precise even when everything surrounding it has stopped being precise, because the geometry of the human chest does not change because the circumstances are impossible. He found his landmarks: clavicle, first rib, the subclavian running beneath the bone, the invisible architecture of it, the precise angle that he had learned not from a textbook, but from a sergeant with 20 years of field medicine who had told him, "You will need this in a dark room with your eyes closed." And Marcus had believed him and had practiced until believing was not necessary, because his hands knew it without his permission. "Pressure," he said. 54/40, said the nurse at the monitor. She had made a decision. Her hands were on the instruments. Her face was frightened and focused simultaneously. Both things true, neither one stopping the other. 2 units of O negative running wide open, Marcus said. Now, one of the operators behind him moved without being asked. He took the blood from the supply rack and handed it across to the nearest nurse, who hung it without looking at Caldwell. Caldwell was still against the wall. He was not speaking. He was watching with the absolute attention of a man whose model of the room had been revised without his input and who was still processing the revision. Marcus made the incision, 2 centimeters, below the clavicle, clean and direct. The tissue parted with the cooperation of something that understood why it was being opened. The field revealed itself under the light, precise and architectural, the body's interior logic laid bare. The bleed was exactly where he knew it would be. High subclavian. A ragged laceration that the field dressing had been pressing closed for however long it had taken to get from wherever they had been to here, and the pressure drop had begun to loosen the tamponade, and the dark arterial blood was welling up fast and thick, the smell of copper rising sharp and immediate in the antiseptic air of the bay. "Suction," Marcus said. The suction was there. He looked up. Across the table, the civilian nurse, who had decided to be useful, was in position, her eyes on the field, frightened, doing her job, both things simultaneously without one defeating the other. "Good," he said. Not praise, information, verification. The word a navigator says when the landmark confirms the heading. He placed the clamp. His hands moved through the muscle memory of more impossible rooms than this one, of rooms that were not rooms, of spaces where the light source was burning wreckage and the clock was the sound of incoming rounds getting closer or farther away, and the only relevant question was whether this person was going to be alive when the arithmetic finished resolving. The clamp seated, he locked it. The bleeding stopped. 68/50, the nurse said. 30 seconds. 73/52. Marcus packed the wound. He ran his hands along Holloway's chest wall, pressing and percussing, reading the quality of the space beneath through his fingertips, the way Torres had once told him was impossible to learn without years in the field, and Marcus had learned in 6 weeks because he did not have years. Both sides clear. The hemothorax was contained. The clamp would hold. "Vascular surgery," Marcus said, stepping back. He stripped the bloody gloves and dropped them in the biohazard bin. He looked at Sandra in the doorway. "The clamp is stable, but the arterial wall needs a graft repair. He has 40 minutes on the clamp. He needs the OR in 30. "They're scrubbing in," Sandra said. "Already called." Marcus nodded. He walked to the side sink. He turned on the cold water and held his hands under it, watching the pink run off his skin and spiral toward the drain. The adrenaline that his body had metabolized into function during the procedure was now metabolizing back out, leaving the specific fine tremor in his hands that always arrived after. He had learned not to fight it. He let the water run over his knuckles until the tremor did what it always did, which was pass. Torres came and stood beside him. The master sergeant leaned against the wall by the sink and said nothing for a moment. He had the quality of stillness that soldiers carry after a long time of needing to be still in difficult places. The kind you could not manufacture. You either had it or you didn't. The OR team arrived in the corridor, wheels on linoleum, voices low and professional, running through the handoff checklist. 91/60, called the monitor nurse from across the bay. Good, Torres said, to no one specific. A long pause. 3 years, Torres said. 2 years, 11 months. Restocking bays. YV bays, mostly. Marcus. I know. Torres was quiet. Then he looked you up. 6 months ago, when the unit cycled through Bragg, he found your nursing license through the state registry. He said he owed you a conversation, at minimum. He said you were the finest combat medic he had ever put in the field. Said it like it was the most unremarkable fact in the world. A pause. He was going to come himself. Marcus watched the water. He'll need physical therapy after the vascular repair. The shoulder will have restricted range for at least 8 weeks. Tell him not to try to shorten it. He'll try to shorten it. I know. Tell him anyway. Torres looked at the sink. He looked at Marcus's hands, which were steady now under the running water. Something moved across his face, not quite a smile, the shape of one. Ghost 7, he said softly. That's not my name anymore. It's what you are. Marcus turned off the faucet. He dried his hands on the paper towel, the institutional kind, rough and brown, that shredded at the edges if you pressed too hard. He kept his pressure steady. He dropped the towel in the bin. He straightened his scrubs. He looked at his badge. The word float sat above his access code in small institutional font. He had stopped seeing it years ago the same way you stop seeing a scar, and now it was visible again, and he was not sure what he wanted to do with that visibility. He left the question where it was. He walked out of Bay 1. The ER had gone to the particular quiet that comes after something large has moved through a space, and not everyone has finished deciding what to make of it. The civilian nurses were clustered near the station. Dr. Foote was standing in the corridor doorway, holding her folder in both hands, looking at Marcus with the expression of someone reclassifying a word they thought they understood. The OR team was rolling Holloway toward the elevator. Torres walking alongside the gurney with one hand resting on the rail, not gripping it, just present, the way you walk beside something that matters. Caldwell was standing near the supply cart. He did not look up when Marcus walked past. Sandra was at the charge desk. She looked at Marcus for a long moment. She looked at his badge. She opened her mouth and then chose a different thing. The discharge pile from this morning, she said. I'll get to it, Marcus said. He went to the counter. He picked up the first discharge form. He uncapped his pen. The OR elevator opened and closed. The operators moved back through the ER in a quieter formation now, their mission delivered. Several of them looked at Marcus as they passed. The last one through was young, mid-20s, with a bandaged hand and the particular drained focus of someone on hour 30 of a deployment. He stopped at the edge of the nurses' station. You go 7, he said. Marcus wrote the time on the discharge form. I'm a nurse. The young operator looked at the form. He looked at the badge. He said, Iceman talked about you. On the bird coming in. He came up for about 90 seconds between the second and third pressure cycles, and the only thing he said was, find Ghost 7. He shifted his weight. Just wanted to tell you that. Marcus signed the form. He pulled the next one off the stack. The operator moved on. The automatic doors at the ambulance bay closed behind the last of the men, and then the ER was just an ER again. Monitors cycling, ventilation breathing its recycled air, the fluorescent lights resuming their ordinary abrasive hum, the one that lived behind the eyes around hour 10 of a 12-hour shift, the one Marcus had been ignoring for 3 years. He kept writing. He was not looking for recognition. He had stopped looking for it in the valley in Kandahar, in the 27 minutes between the blast and the medevac landing, when recognition stopped being a category that meant anything compared to the simpler, more urgent question of who was still breathing. He had brought that simplicity here and installed it behind a face that people read as slowness, and he had let them read it that way because the alternative was explaining himself, and explaining himself meant opening the box, and opening the box meant living inside it again, and that was not something he had the spare weight to carry. He worked instead. He worked because the work was real, and the people in the bays were real, and the arithmetic of whether they lived or did not live was the same arithmetic it had always been, dressed in different clothes, in a cleaner room, with better lighting and worse coffee, and people who sent him to restock shelves when he was not looking at them. The discharge pile worked down. He picked up the next form. He entered the vitals. He signed the time. 3 bays down, Caldwell was charting at a workstation with the quiet, inward focus of a man working through something private. He did not call Marcus's name. He did not send him anywhere. Marcus noticed this, and noted it, and returned to the form. In the OR on the 4th floor, a vascular surgeon Marcus had never met was repairing a subclavian artery with a saphenous graft, working against a clock that Marcus had bought him by arriving at the table with the right hands and the right knowledge and the long, accumulated practice of having done this before in rooms where the only margin for error was none. In 3 hours, Holloway would be extubated. In 5 hours, he would ask for water. In 7 hours, he would ask the recovery nurse if Ghost 7 was still in the building. The recovery nurse would not know what that meant. But Marcus would be there, on the floor, writing forms, drawing blood, catching things that had not yet announced themselves to anyone else, doing exactly what he had been doing for 2 years and 11 months, in a building that had never asked him to explain what that cost, or what it came from, or who he had been before he came here and decided that being useful was enough. It was enough. It was what he had. The pen moved across the paper. The lights hummed. The monitors kept their time. Marcus Webb kept working. If something in this story reached you where you needed to be reached, share it with someone who shows up quietly. The people holding the line rarely hold a sign. Subscribe for more stories about those who serve without waiting to be seen. Drop a comment below. The world is full of Ghost 7s. Tell us about one you know.